Okay, good morning, everybody. My name is James Cooper. I am the president and CEO of the Pleasanton Chamber of Commerce, and I'd like to welcome you this morning to our educational presentation by Stanford Health Care Tri-Valley called Expansion in the Tri-Valley Community. I'd like to thank our fellow chambers for joining us today, the Livermore Chamber of Commerce, the Dublin Chamber of Commerce, the San Ramon Chamber of Commerce, and the Danville Chamber of Commerce. So today's presentation will be a discussion about Stanford Health Care Tri-Valley's acquisition of an office complex inside the Hosienda Lakes Office Center. We'll talk a little bit about our population growth and the continued expansion to meet the demands of the Tri-Valley community and the new and expanding services that will be available to the Hosienda complex and the folks that go there for their services. To give us this presentation this morning is Mino Sastry, the Vice President of Service Lines and Market Development. So before I welcome Mino and have him take over, I want to tell you just a little bit about him. Mino Sastry has over 25 years of extensive experience in healthcare and hospital industry. His background includes roles in senior operations, facility and capital planning, business analytics, financial performance management, and organizational structure development. For the past 10 years, Mino has held hospital administration roles for the Stanford Health Care Enterprise. And for the past 5 years, he's been part of the executive leadership team at Stanford Health Care Tri-Valley campus, where he's responsible for identifying, implementing, and growing the advanced and complex clinical programs that have historically been available only in Palo Alto in order to bring them here to our Tri-Valley communities. Mino is also a 3-year member of the San Ramon Chamber of Commerce Board of Directors, and as of January 1st is starting his first year as board chair. Welcome to the catbird seat, Mino. Finally, Mino has resided in San Ramon for the past 14 years with his wife, Ali, and 3 children, Maya and Nicholas, who are 13, and Liana, who is 11. So with that, everybody, please welcome Mino Sastry.
Thank you, thank you, James. Appreciate the introduction, and certainly thank the Pleasanton Chamber of Commerce for hosting this event this morning and giving me an opportunity to share all the exciting new developments that are happening right around us here in the Tri-Valley. So I'll go ahead and get started here. So before we jump into everything that's happening, I just wanted to give a little bit of history, a little bit of story of exactly how we got here. And it really is a methodical approach of, you know, when Stanford wanting to come to the Tri-Valley and build the programs and the services and support this community. There's a lot more to it than just coming in and building programs, right? And so I just wanted to share just a little bit of exactly what we did to get to this point. The very first thing we did is really understand the Tri-Valley population, very in-depth market analysis to understand who's actually living out here in the Tri-Valley. What's the population look like? What are the demographics? What's going to be the growth of that population, not just for the next 5 years, but the next 10, 20, and 30 years. And so we were able to do that with our very talented market development team, looking at a lot of data and looking at all the other competitive factors within the market. The next thing, and certainly something I'm very proud of as a leadership member, as an executive leader here in the Tri-Valley, we have the opportunity to be in the community and be active members in your community. We've been set up on a number of boards, as you heard in my intro, and many of the executive leadership team are on boards of the Chambers of Commerce locally here in the Tri-Valley. We also serve on other boards. We're also active members on other volunteer things in the community. We're meeting with city officials, supervisors. We also have local donors in the community that we interact with on a very consistent basis. And so the market analysis and the data aspect of it, but also just the direct conversations we've been having with influential business leaders and city officials and active members of your guys' community, that helps complement and validate a lot of what we want to do. Next step is a simple gap analysis. So we started to understand exactly the types of healthcare services that were being provided in the Tri-Valley in current state. So what were those services? And then certainly what were the services that the community wanted that were kind of lacking in this area, or that the community was having to travel great distances, whether it's Palo Alto or San Francisco, or even further for certain types of services. So we wanted to understand what are the services being built today? Are the quality of those services to the level that our community wants? And then what can Stanford do to kind of fill that gap? So that prompted us to do and write a very comprehensive strategic plan. And we completed that strategic plan about 3.5 years ago. So we're about 3.5 years into it. And what you're going to see in the rest of my presentation is really we've far exceeded the expectations in our strategic plan a lot sooner than we could have ever projected. And so that will also, what you'll see, is prompt a number of newer investments that we're having to make to fulfill that demand. So once we completed our strategic plan, we started to execute against it. We started to build those programs, and ultimately we started to recruit and bring all of those Stanford high quality specialists into this community. And that's kind of what you're seeing over these last 3.5 years. And what we've seen in our facility is since that time, and for the last 4 years, we've literally continued to care for more and more Tri-Valley community members, residents, consumers, patients, families, year over year. From our inpatient surgeries. So you can see that we've gone from 11,000 surgeries we were doing a year in fiscal year 20 to now almost 17,000 surgeries a year. So a 50%, 54% growth over the last 3 years. Elective visits. So these are folks coming into our facilities for things like X-rays and MRIs and ultrasounds, for blood work and lab work. We've seen that grow, the demand for those services grow from 48% over that same span. And then lastly, as many of you guys know, your first visit is typically into the clinic, whether it's your meeting with your primary care doc, or you're meeting with your local specialist like a cardiologist or a neurologist or a gastroenterologist. Those clinic visits have also exceeded our growth expectations in a lot quicker time period than we could have ever imagined. So that's gone from 123,000 patients we were seeing walking into our clinics to now over 180,000 patients walking into those same clinics. And so this is what really is prompting a lot of the more recent developments that you'll hear about in just a few minutes. So because of what you just heard, I want to share with you the work that we're doing to really fulfill that commitment to developing our unique, high-quality service offerings and really providing access to the full continuum of care for our residents of the Tri-Valley and beyond. So let's first start with just the walls of our hospital. As the growth and the demand for our services continues to exceed expectations over the last several years, it's very important that we catch the infrastructure up within our hospital to meet those demands. So we're certainly bringing new programs, very complex programs. We're seeing more in-depth diagnosis, and the treatment of those involve a lot more infrastructure and new equipment. So right now, anybody that's walked through our hospital, you probably see a lot of construction. And one of the projects we're undergoing right now is a multi-year, multi-million-dollar expansion project that will not only upgrade our 2 cath labs, we're actually adding a 3rd cath lab. This is going to be able to support a lot of our in-depth cardiovascular services. In addition to that, we're also upgrading our GI lab, which is the lab in the OR that really supports a lot of our advanced endoscopy needs. Also a demand and a need that we've identified in our market analysis and what we're actually seeing with a lot of those patients coming into our facilities. And so while we're able to perform all of those things today, this is an upgrade of the equipment, of the infrastructure, creating larger rooms, and just be able to handle a lot more of those complex diagnoses. So that project's going on right now. We'll continue to work through that for the next 2 years before that piece is complete. The other exciting development, and want to thank our leadership team and all of Stanford, is we are undergoing a very comprehensive master design plan. And so one of our major pain points for anybody that's been to our hospital right now is our emergency department. So one of the things you will see over the next 5 to 7 years is a brand new emergency department, a complete expansion. Currently, we have 18 rooms in our emergency department. When all said and done, we expect to have almost 38 exam rooms in our emergency department. In addition, with all the growth, we need another bed tower. This will allow more patients to be sitting in our hospital beds, so creating a whole new inpatient bed tower. Because of the complexity of the types of procedures we're doing that we didn't do maybe 5 to 6 years ago, a lot more advanced procedures we're doing in our hospital that also unfortunately lands patients in our intensive care unit. So we have 23 intensive care beds today. We want to grow that because we know the expansion of our complex care is going to only grow over the next several years. So this master design plan is going to give us a new bed tower. It's going to give us a new emergency department, and it's going to give us more ICU beds. And once again, that's in the design stages, and we hope to complete that major project over the next 5 to 7 years. I talked a little bit about the complexity of our procedures. Stanford's always invested in state-of-the-art imaging technology. This allows us to complement and support our surgeons with the best types of surgical care by pinpointing accurate diagnosis. And so the Tri-Valley Hospital, historically, a lot of our imaging equipment and our imaging platform was outdated. It was at the end of their life. As we started to bring in these complex services, we made major investments in all of our imaging platforms, from MRI to ultrasound to X-ray. Many of these imaging equipments are better equipped to support our cancer care and our pulmonary lung cancer screenings, all of these things, cardiovascular care. So these latest technologies are a lot more equipped to really pinpoint the types of patients that we're now starting to see come into our facilities. And once again, why we're doing this is many of these patients, many of you in the audience today, 3, 4, 5 years ago, for the types of things you're able to now get at the Tri-Valley Hospital, unfortunately, you were having to travel to Palo Alto or to San Francisco or to other further academic facilities. And so we're really proud that we're able to bring a lot more of those capabilities right here into our community. So we talked about the hospital infrastructure that will continue to go on for many years. But as I mentioned, over the last 3 years, we've had a number of programs that we've grown. We've added more specialty, but we saw the growth of those services accelerate quicker than we could have expected. And so we will be expanding our clinical footprint. So the outpatient clinical, once again, as you walk in, the first things you're doing is you're walking into a clinic to talk to your doctors. We need to expand all of those clinics from where they're at today. So we have 2 medical office buildings right next to our hospital. Those 2, I'm actually sitting in one right now and doing this presentation, but those 2 medical office buildings are going to get reconfigured because we have to reconstruct a number of new clinics to support the growth that we're seeing in those services. And I'll talk a little bit about exactly those clinics in a few slides in just a minute. Now, what that also means is as we grow those clinics and those capabilities so we can recruit more advanced specialists, we actually have more exam rooms so we can see more patients in a given day. Whenever you bring more patients into your clinics, that generates more procedural needs. So as you come in, the more patients that come in, typically a percentage of those patients are also going to have some advanced conditions that are going to require some procedures. All of those procedures don't necessarily need to be done in a hospital operating room, but there's only so much capacity we have. So in addition to building these clinics, we are also investing in 4 surgical procedural rooms right here on campus. The difference between those procedural rooms versus the hospital operating room is these will be definitely, certainly some procedures that are more on the outpatient side, a little bit more minor. You may not need to stay overnight. And so we're trying to build 4 additional procedural rooms right here on campus over the next 2.5 years. And that gives us more capacity to, once again, the whole point of this is we see a demand, more patients in the Tri-Valley and beyond the Tri-Valley, Central Valley are coming into our facilities, requiring these services. We don't want to have you guys wait months and months. So by building more capacity, we're able to get you in sooner, get you treated, and get you home safely. And so that's another major investment we're making right here on the Pleasanton campus. To talk about some of the things that have been done and that are also happening on the outpatient clinic side, really proud. We had a nice little event last summer. We opened up a state-of-the-art heart and vascular clinic on our Pleasanton campus. So it's right on the ground floor of the 5565 West Las Positas building. It's a 6,300 square foot state-of-the-art facility. It features the latest in cardiac, vascular, cardiothoracic, and interventional cardiology diagnosis and treatment capabilities. And it's serving all the patients right here in the Tri-Valley. Once again, some of those services existed before. We're bringing a lot more advanced specialties and experts within the cardiovascular service line to treat a lot more of those complexities that historically we weren't able to provide care for. Also extremely excited, last summer also, we expanded our cancer clinic in Pleasanton. Our cancer clinic in Pleasanton is looking outside my window. It's right down the road there. It's 5725 West Las Positas Boulevard, literally 2 blocks from our main hospital. We went from 9 exam rooms in our cancer clinic to 20. Once again, what that enables us to do is recruit more cancer specialists into the region to serve more patients in a given day, in a given week, in a given month, in a given year. We're able to just provide more access to our cancer specialists, Stanford Cancer team, to the Tri-Valley community, so you're not waiting months for an appointment. So we achieved that last summer. Literally 2 weeks ago, also in that same building, in that same footprint, very excited that we've upgraded our linear accelerator. State-of-the-art modern technology, finally, that we were able to install in that Pleasanton Cancer Center. This will enable us to provide up-to-date radiation oncology treatments for advanced cancer care. Once again, certain levels of complexity of cancer care historically weren't able to get those folks properly treated in these facilities, and so we were having to transfer those out to our Palo Alto sites. With this latest technology, we're able to now see more of those advanced diagnoses using this brand new upgraded linear accelerator. So once again, a few blocks from our Pleasanton Hospital campus, 5725 West Las Positas Boulevard. And then lastly, around the Cancer Center, really, really excited. This is a little bit more of a longer term development. This should be ready by next summer, but we are going to expand our infusion center. So all of your chemotherapy needs. This is underway. The design of the construction is underway, and we are going to be expanding from 14 infusion bays to 30 infusion bays, and this should be completed. There's 2 phases of the project. First phase will be completed in March of 2024. Second phase will be completed by July of 2024. Once again, this enables us to go from 14 to 30, more patients in a given day walking through our cancer walls, getting the necessary and critical treatment that they need. They're not having to wait long for those appointments. We're also able to expand our staffing and our resources to support this population. So we're continuing to increase our workforce as the expansions get developed, as we're bringing in more treatments, more oncologists. We're also being able to hire more people to support those services as well. So really, really exciting developments right here in Pleasanton and for critical services like our cancer service line. Okay, if that wasn't enough, meaning investing in all the services that are already existing, that are already growing, you're right, there's more coming. And some of that is, once again, continuing to do market analysis, continuing to be active in the community. What types of services are kind of needed here as the population continues to grow? All of you are members of the Tri-Valley. You're seeing kind of the demographics, the types of families and individuals that are growing in the Tri-Valley. There's a need for more advanced types of services to serve our community. So we're really excited right here in Livermore. In the summer of this year, you will see the extension of Stanford Healthcare's nationally renowned Byers Eye Institute. So we will be bringing the same ophthalmology service line to the Tri-Valley and specifically to Livermore. So later this summer, a brand new clinic will open up where there will feature Stanford ophthalmology faculty specialists, and they'll be able to support all of our advanced treatments for cornea conditions, for advanced glaucoma, and major eye diseases. And really many of the local ophthalmologists are excited about that. And, you know, there's a great relationship that we're building here with all of our local ophthalmologists so that we can come and really provide a lot of those advanced services that sometimes their patients are going to need. And so really, really excited about that development. More to come. There's definitely going to be a community event we're going to be planning for the opening of this clinic later this summer in Livermore. And so we'll work with our teams to make sure that information gets out to the community. Another new program that you guys will hear about and be able to access if needed here in the Tri-Valley later this summer is reconstructive plastic surgery. Critical need, as well as our cancer care program grows. The need for breast reconstructive surgery, something at the moment you can only get, that the in-depth types of reconstructive surgery you can only get in Palo Alto or at UCSF. We're now going to be able to provide right here in our Tri-Valley Hospital. It's a great complement to the care of our cancer patients, certainly breast cancer patients in particular. But reconstructive plastic surgery really supports a lot of the complex service lines when needed. And so, you may see a theme here, as Stanford grows their programs, we start with our community-based general programs. We then advance those to treat more complex conditions within those service lines. As you do that, you start to attract a lot more other advanced disease states. Many of these involve a lot more specialty surgical capabilities. And this is what then dictates, hey, I think we need reconstructive surgical specialists to also support some of these other service lines. And that's really the methodical approach that we've been taking over these last few years. As the need and the demand continues to grow, we then surround it with more comprehensive care, so that for the most part, certainly not everything, but for the most part, once you come to our facility, we treat you with your surgeries. Any other situations that arise, we're hoping we can take care of you right here and not have to send you anywhere else. So that's really the mission and the goal as much as possible of Stanford Healthcare. So I talked a little bit about the clinics that are coming online. And so I just wanted to give you an idea of a few of those clinics that we're building in these 2 medical office buildings. So once again, these services already exist. These clinics already exist today. But because of the growth, we have to create a larger footprint. We have to provide them more exam rooms. But that also affords us the opportunity to recruit some advanced specialists to grow programs. Just to name a few, gastroenterology, we have those services today. By expanding their clinical footprint, we're building a clinic right outside in this building. We're going to be able to create more advanced hepatology services, liver services. That's also a need. One of our market analysis showed that there's a lack of hepatologists from the Tri-Valley all the way down to Fresno. Those folks don't have somewhere to go to get very advanced liver disease treated. We have those capabilities here at the Tri-Valley. And so our clinical footprint, our larger clinical footprint, allows us to hire not just 1 hepatologist, but 2 hepatologists to support that patient population. Neurology, this is the one I'm extremely excited about, because since I've been here in the Tri-Valley, one of our biggest gaps was outpatient neurologists. We only had 1. We now have 4. So we hired 2 over the last year. We have another one that just joined us. Once again, same geographical gap from the Tri-Valley all the way down to Central Coast and Central Valleys, a lack of neurologists in the region. And so we're able to provide now a lot of those complex neurology services. In particular, epilepsy monitoring is a service we're going to be building this year, and working with some local folks that really support that epilepsy population. So really excited. Urology, pulmonology, building a lung cancer screening program and a chest clinic. These are just a tip of the iceberg in terms of some of the services that continue to grow. The demand continues to be there as our Tri-Valley populations continue to grow. We now have that capacity to hopefully fulfill a lot of that demand. So really excited about that. All of those things, all of those brand new clinics are starting now. Some will be opening up in the spring, the summer, and our last one, pulmonology, will open up in January of 2024. Okay, hitting toward the end of our presentation slowly here, but really excited, especially for the folks here in Pleasanton. You might be familiar with this site. This is the Hosienda Lakes campus. Right off, it's basically 4 streets, right? You got Hosienda, you got Willow, you got Gibraltar, and then I believe it's Inglewood Drive. It's a 5-building campus. Really excited that we were able to close this deal and purchase outright the entire campus. The campus spans about a little under 200,000 square feet of commercial building space. This investment is integral to us expanding the quality of care that we want to bring, the complexity of the types of services we want to bring and offer this community. So just to give you a few highlights, number one, this building right here, hopefully you guys can see my mouse. This building right here is already live. It has Stanford Primary Care. So that's been live since March of last year. So for all of your primary care and family medicine needs, imaging, this is where hopefully a lot of our patients are going to get their at least initial treatment. Our plans right here for this neighboring building is going to be a second surgical center. So an ambulatory surgery center. We have one in Livermore. I'll talk a little bit about that in my next slide. But just so you guys know a little bit of healthcare background, the industry is shifting. It's been shifting for many years. It's only going to shift even more. So many of the folks that come in for surgery these days, obviously there's a lot of complexities and depending on certain other conditions that you may have, those will be inpatient where you have to recover in the hospital. But a majority of the surgeries these days with our advanced technologies and our specialists and the trainings and the robotics that are involved. And also, unfortunately, a part of healthcare is also how you get paid. And our insurance companies have a say in what actually happens, and Medicare, as you guys know. So there's a lot of shifting of procedures into what we call these ambulatory outpatient surgical sites. So we see the writing on the wall. And so a lot of the surgeries that were historically done in the hospital now are going to be forced to be done in these outpatient surgical settings. So we're preparing for that shift in the market. And so this building right here is going to provide us a second ambulatory surgical center right in Pleasanton. Roughly, we're designing about anywhere between 6 ORs to about 10 ORs. We're just going through the plans right now, but that's going to allow us to create so much more capacity in terms of surgical growth. Right next to there, we're going to be building a multi-specialty, another Stanford faculty multi-specialty clinic. Once again, this could be growth of existing programs where we've run out of space. This gives us the flexibility to really build more. But it's also, once again, as you've seen just in the last few years, there's going to be new programs, new things that the community is going to need, that they're going to demand. And so we want to be prepared to have the ability to bring those services. And this affords us that opportunity. We're also able to partner with local providers. So non-Stanford providers, we are partnering and providing a partnership where they can also build in partnership with us a multi-specialty clinic capabilities. And so we're offering those services as well and the opportunities to our local providers that have existed in this market for many, many years, even before Stanford. So I'm really excited about that partnership. And then lastly, no immediate plans, at least over the next 3 to 4 years in this building. We have a number of private tenants there today, but the plan over the long term is Stanford's famous for their clinical research and education. So really excited to work with our Stanford University School of Medicine to really bring clinical research and education and training platforms to this site as well. So really, really excited. You guys should all be excited in the community over the next several years, some as quickly as 2 to 3 years, and then expanding over the next 20 years, what this campus can really turn out in terms of healthcare, in terms of Stanford, and in terms of just community presence. And so really excited about that development. I'm going to wrap up here in just a couple more slides. So Livermore, don't want to forget about Livermore. We already have a surgical center in Livermore and a number of clinics, as I mentioned. What we are preparing, and part of the reason we're also building that second surgical center in Pleasanton is our surgical center in Livermore really is going to be transitioning into a full-blown orthopedic surgical center. So the demand for orthopedic services, sports medicine, hand surgery, spine surgery, all of those things are growing in this market. We've been able to provide those services. And so that surgical center over the next few years will be 100% orthopedic surgical center. And so if you're parents of young athletes, unfortunately, as athletes, injuries do happen. Hopefully they'll be able to get all of their orthopedic needs right here in Livermore at that center. Really excited. I'm at the end of my presentation, but I want to leave you with one thing. I'm really excited about all the investments we're making. It's all designed to expand our programs and services, all programs and services that we've heard this community wanting. This also is going to allow us to attract some amazing talent, to the workforce over the next several years. And we, are committed and doing everything in our power to continue to care and support for the community here in the Tri-Valley well into the future. So now, if you can indulge me for another minute before we jump to questions and answers, I did want to share a nice little video with you to kind of wrap this all up. So give me 1 second here.
Everyone, Mino has a video for us. He's going to show us shortly, and then he's happy to answer any questions that you guys would like. So hang tight and we can continue the conversation.
All right. And so let me reshare my screen and hopefully this works.
Okay, who's in? The early risers, the lunch makers, the hand holders, they're in. The experts, the innovators, the game changers. Everybody's in. Building, expanding, investing like never before to bring thousands of square feet of new facilities, services, and treatments to the Tri-Valley community and beyond. This is Stanford Health Care Tri-Valley. We're world-class medicine. It's the compassion of locally based care. And together, we're all in. Stanford Health Care Tri-Valley. Welcome to What's Next.
Thank you, everybody. I appreciate the time this morning, and I hope you enjoyed what you heard. And I'm happy to take any questions. Susie, James, I'll hand it back to you.
Thank you very much, Mino. And that was a tremendous presentation and very, very impressive to see all the things that are happening with the Stanford Tri-Valley campus and all the plans that you guys are making. I'm just going to ask just real quickly, that strategic plan that you guys put together, that's an impressive document. You said at the beginning that you were farther ahead of that in this time frame than you expected to be. How long has that plan projecting forward for, and is there a lot more on the list still to do?
Great question. Actually, the timing of that's great because so it was a 5-year strategic plan. We're about 3 years into it, and you're absolutely right. In year 3, we were probably where we thought we were going to be in year 4, or even in year 5 to some degrees. With the exception, maybe one thing in our strategic plan, and I'll be transparent, the trauma program was something we wanted to bring to the Tri-Valley that we weren't able to, at least at this time. It's on pause for the moment. Everything else has far exceeded our expectations. And so to answer the latter part of your question, we are now at a moment where we may have to reinvest, and just talking to my boss, our CEO, Rick Shumway, we are in the planning stages of re-pivoting and creating another version of our strategic plan. So we're not going to wait for 5 years. We're in year 3.5. It's probably time to kind of relook at it and kind of project again for the next 5 to 10 years. So we're going to be starting that process this year.
Well, as someone who's going through the process myself in my own organization, I can say I'm very, very impressed with all that you've shared on that. We do have a couple of questions. Let me start with the first one that's on my screen, Mino. From Tim Toda, what is the current employee footprint and what are the projections related to the expansion?
So I'm going to ask, don't quote me on any numbers, please. But I will say this. The nice thing is we have Tri-Valley employees, right? The local Tri-Valley employed by our entities. We have a number of Stanford Health Care employees that work 100% in the Tri-Valley. So we consider all of that part of our workforce, our Stanford medicine partners. That's the Stanford healthcare system. And so multiple entities all being employed right here in the Tri-Valley. Tri-Valley itself, I believe we're anywhere between 1,400 total employees, roughly. And I do ask you guys not to quote me on that. We can get you exact numbers. The expansion, no way I can project it. I can just tell you with all the expansion of services, what you're going to see is more physicians coming to our communities. You're going to see more advanced practice nurse practitioners. You're going to see RNs. You're going to see LVNs. You're going to see imaging techs. The growth of that. Now, with that said, if any of you do follow kind of the healthcare or in healthcare yourself, there's challenges today recruiting. Since the pandemic, it's been a challenge. You know, people have kind of looked at healthcare a little bit differently. Some people may be a little bit burnt out. There's shortages of radiologists in the market. There's shortages of nurses. One of the challenges is you've got a lot of people joining, you know, what we would call the consulting world, the traveler world, right? And nurses, where they, rather than be employed directly by a hospital, they're going to join an agency where they can travel around and kind of be where they want to be. And that's difficult. And when we have to do that, we go down that route, but we certainly are hoping, one, the Tri-Valley is still a very, very attractive community that people are going to want to come and live. I know the cost of living is ridiculous. I feel the pain as well. But with all of these brand new jobs, if you're in that career path, we are going to do everything in our power to attract a lot more of those really high professional positions into the market. So I know I didn't give you the exact numbers, but a lot of those nurses, radiologists, imaging techs, LVNs, support services, so engineerings to support our buildings, housekeepers to support our buildings. So a lot of that will grow with the expansion of these services, absolutely.
Wonderful, thank you. Tracy Farad asks, with such an impressive increase in facilities and functionality, where do you see your patients originating from? Will it include local residents as well as visiting customers? And will there be a greater need for overnight visitation?
Great question. And I'll hit them all. And we do this all the time. I look at our analysis. I look at where our patients are coming from. So I'm going to say this: majority of our patients, Tri-Valley, Dublin, Pleasant, and Livermore. What we've seen over the last 3 years, I'll pick 6 zip codes: Castro Valley, Hayward, San Ramon, Danville, Tracy, and Mountain House. We've expanded those zip codes dramatically over the last 3.5 years as well. Why? Because those areas don't have certain services, especially Tracy and Mountain House. And as we've started to develop those programs, they started to come to our facilities. And then to the other parts of the questions, because of the level of Stanford programs, so for example, cardiovascular, orthopedic, spine capabilities, advanced endoscopy, these are cancer care. These are areas where, you know, I'm proud to say I'm part of Stanford. We offer a different level of care, more in-depth complexity. Our specialists are highly trained, nationally renowned. So we do have relationships with facilities in Hawaii, for example. They come to our facility for cardiovascular care. They get transferred in for certain conditions. We are starting to see a lot more patients from Central Coast and Southern California for certain conditions that have partnerships with Stanford. So historically, they would go to Palo Alto. Now, not everything. If you need a liver transplant or a heart transplant, you're still going to Palo Alto. If you need neurosurgery, you're still going to Palo Alto. But we can provide a lot of those services in the Tri-Valley. And so now what's happening is, because their families are a little bit closer to the Tri-Valley, it's a little bit easier. A hotel maybe is a little bit cheaper here than in Palo Alto. We're able to take some of those out-of-town patients and their families here. So we are definitely attracting patients from Reno into our facilities as well. Certainly Palo Alto still gets the bulk of those out-of-state patients, but we're certainly seeing our fair share as well.
Okay, thank you. From Mary Grace Gomila, hello from your neighbors at 5925 West Las Positas. Can you please expand on the comment you made about partnering with other providers' clinics at the Hosienda Lakes location?
Yeah, so we have a number. I mean, any healthcare system can only survive if you can't do it by yourselves. And so we rely on local providers, non-Stanford, primary care docs, other specialists in the Tri-Valley and San Ramon, or even in Central Valley. support their needs. And so not every healthcare system has the capital and the ability to grow all of the programs that they need for their community. So that's where Stanford will play a major pivotal role in partnering with those providers. And so part of their growth is they may not have capital to invest in a major building to grow their clinical programs. So, whether it's Sutter or PAMF or other independent doctors, what we've been able to is build very strong relationships with them. And now with the purchase of the Hosienda Lakes campus, we're offering them an opportunity to build out some of those clinical programs on that site, using us as their partners. And so we would also be able to partner with them on surgical needs. So if they need access to the surgical center that we're going to build in the next 2.5 years, we're going to work with them to provide access. And so that's kind of the high level plan in terms of working with some of the local providers. So, extending that olive branch to what maybe people may say, those are our competitors, we view as our partners, because at the end of the day, we want to serve our Tri-Valley patients as best as we can. And if we partner with folks that are already serving them, I think that's the best way to go.
Thank you, Mino. Thank you, Mino. And I agree. I love to see that intra-industry collaboration piece.
Yeah.
It just strengthens the entire industry for all involved. Diana Hall asks, what are you doing to shorten the wait times on hold to get to schedulers for doctor appointments?
Yeah, great question. One is we have so a couple things. I'll answer it a few different ways. We're fortunate to have what we call a Tri-Valley ambassador and physician liaison. So part of their role is they are talking to all of your doctors. And so when I say your doctors are making a referral into our Stanford specialist to get you as a patient an appointment. So part of their job is to be the voice of the customer, the voice of our referring providers. So they should be bringing just a lot of that data and feedback to us. Hey, we're hearing from this practice in Pleasanton, these types of patients, they can't get their patients into whatever CVH clinic. It's taken months. So one is we right away work with our clinics to address whether it's process efficiencies, some administrative hurdles. Sometimes it could be an insurance thing. So we're looking at just process, logistics, administrative hurdles that kind of occur in any business. And we try to break those down. But a lot of it is what I just shared in the bulk of my presentation. A lot of it is the growth that we're seeing is we can only do so much. We have a certain number of providers today. We have a certain number of exam rooms today. There's only 5 days in a work week. How do you get everybody in a timely fashion when the growth just keeps accelerating? And so part of the investments we're making is we need to expand our clinical footprint. We need to create more exam rooms. We need to bring in more providers when needed. We don't want to saturate the market with providers that aren't busy. We want to do it in a targeted way. That allows us to reduce your wait time from a 1-month appointment time to maybe 2 weeks. And so that's the goal with all of these investments and expanding the clinical footprint.
Thank you. I think we have one more question here from Cindy Epstein. Will this also include an expansion in your pediatric footprint?
Yeah, great question. Tough one to answer. Historically, I'm going to be very honest and transparent. We have minimal pediatric capabilities. It's definitely something we're constantly looking at. What we certainly want to do is, and one is we have a minimal pediatric footprint, but we are looking to expand that. We are looking at what is appropriate in terms of pediatric population. Now, definitely the age groups like the 14 to 18, we can handle a lot of those things. When you start to take a look at more of the younger kids that might be coming through our EDs or more advanced conditions, we certainly partner with our Stanford Packard group. Now they also have a presence in the East Bay. Some of you guys know in Bernal, they've got their clinics there. So we have great partnerships with them. And then a lot of those complex conditions, similar to how we send some of our patients to Palo Alto for those advanced conditions, for the pediatric population, where we have partnerships with Children's Hospital in Oakland and our Stanford Packard Hospital in Palo Alto. But we are making an assessment of what are the types of pediatric populations we should be serving and how do we grow that service? And so that's a plan, you know, James, to your earlier point, I think that's going to be a big part of our next phase of our strategic plan is what is the pediatric strategy and vision?
Yeah, I agree. Thank you, Mino. Tracy is waiting with another question here. With increased healthcare professionals coming to your new campus, are you building or allowing for on-site training and meeting spaces, or will you be in the larger Tri-Valley meeting and event space?
I'm thinking that's a business proposal somewhere in that question. Way to go. You take advantage of every opportunity you can. That's what I say. Yes and yes and yes. Now, part of our construction teams, we typically, as we grow, they're always thinking about, okay, what support spaces do we need? Do we need some food options? Are we going to build a cafeteria? Are we going to build some on-site, you know, to-go options? Are we going to need big conference rooms? What types of conference rooms? Are these clinical conference rooms where they're going to do clinical trainings, or is it just, you know, administrative meeting space? So the answer is absolutely yes. The Hosienda Lakes campus does give us that opportunity because, you know, we've got 200,000 square feet of space to work with. But happy to always engage in outside local businesses. I'm a member of the chamber, so anywhere we can support our local businesses, happy to have those conversations.
Thank you, Mino. I'd be remiss if I didn't mention that you had compliments from both Jamie Renton and Judy Lloyd early up in the chat thread.
Thank you.
If there are any other last minute questions, I'll give you all another few seconds to weigh in here. And I'm not seeing anything pop up. So, Mino, I want to thank you very much for your time and for a wonderful presentation. And thank you to Stanford Tri-Valley, as always, for all that you do to support the communities and especially the chambers of commerce. And we really appreciate this partnership, and we're looking forward to our next educational series. Who's next on the list, Susie? Do we know where we're going to be next, which chamber we're going to be with next and when?
I'm not sure if that's confirmed.
Okay. But for all those that are on, that are listening on the call or that watch this following the event, this is the first of a series of events. We expect there to be 5 total this year. So please keep your ears open for the next series event. As it becomes confirmed, it will certainly be coming down channel to all of you. So on behalf of the Pleasanton Chamber of Commerce and all 5 of our chambers, thank you very much for joining us today for this presentation. Thank you, Mino, and thank you, Stanford.
Thank you, everybody.